are going to talk today about the use of biomarkers for dementia detection in the MENA regions, some opportunities and challenges.
That's an important question, and it's a good research question that is ongoing now, actually, because people, as you know, with advancing the biomarker, we are now being able to probably preclinical diagnosis of Alzheimer before happening. We have a possible diagnosis that the patient will develop dementia. So the caregiver has to prepare 10 years, 15 years, 20 years before the actual care happening. So it gives a person enough time to prepare. And it's a very sensitive issue, and this is why it has to be done probably better by the GPs, family physicians, and not by the specialists, because the family physicians is closer to the patient. So the relationship between the family physician and the patient is better than a specialist or a tertiary care physicians. However, in certain people, it may increase the stress level, because knowing that your beloved one will eventually develop dementia is highly stressful. The advantage of pre-caregiver is one thing: if the disease-modifying drugs improved and we have more disease-modifying drugs, then things will be easier, and probably people will start planning ahead of time of taking medication before reaching the dementia stage. And probably, hopefully in the future, we'll be aborting altogether the caregiver ideas, and then the patient will be dementia-free. We have dementia-free community.
I totally agree with you, and I think that this pre-care concept is very important. There used to be a kind of philosophy that if you cannot impact or affect a disease effect from occurring, so something like Huntington's chorea, which can give you a different sort of mental brain issue problem, then it was unwise to actually send people off for a test to see whether they did or didn't have it. There have been many arguments where children have actually gone against their parents' wishes and had such a test. Now, in recent, perhaps past 20 years, I have evolved and seen through practice that people do want to know if there is something that they can foretell. They do want to know so they can prepare. So I agree with Dr. Razak's own words there of, maybe there is a justification in finding out so people can prepare for what is to come. It's a very important issue to keep simple and keep it in perspective and be honest and open and not actually be covert or, shall we say, play it down, dumb it down and say, it's okay, we'll look after you. It can be very, very serious effects here. And each biomarker, like tau or the various PSEN 1s and 2s, if they are found, they don't necessarily exert the same degree of expression. So it's a measured advice. I think a discussion with the patient at all times is very important, as well as the caregiver, so they know what to do, because in many cases, the caregiver's life is changed completely and devoted to that particular patient, maybe their spouse or a sibling or a parent, which is life-changing for them.